Public service announcement! Hi, my name is Rachel Easley, and today I'm going to be talking to you guys about candidiasis. What's candidiasis? Good question, I'm glad you asked me. Candidiasis is a fungal infection caused by yeast from the genus Candida. Now usually Candida yeast chill in our body with no fuss, not causing infection in our intestinal tract and even in our mucous membrane. But when there is an overgrowth of Candida yeast, that leads to an infection called candidiasis. There are three types of candidiasis: oropharyngeal, vaginal, and invasive. Invasive is when it's in your bloodstream, and I won't be touching on this one too much today for the sake of staying on topic with STIs. So let's jump right in with the first type, oropharyngeal candidiasis, more commonly referred to as thrush. You might have heard of this before. Now, what causes thrush? Well, like I said earlier, there are already Candida yeast present in our body, including the mouth and throat region. And an overgrowth can happen, or usually happens, due to a weakened immune system. A change in the environment of your mouth or your throat can also be due to poor oral hygiene as well. People who have thrush generally experience white patches on their inner cheeks, tongue, mouth, and throat region, accompanied by redness and soreness of this area of the body. It is also very hard to eat and drink. Swallowing in general is painful. You might also experience loss of taste if you develop thrush, as well as cottonmouth or dry mouth. Doesn't sound too fun, right? So how do you prevent it? Well, let's practice good oral hygiene, and if you use an inhaler or a mouthpiece or any device that you use with your mouth, it's important to keep that clean and dry whenever you're not using it. Also, if you're taking corticosteroids or antibiotics, it's a good idea to also take probiotics at the same time. People who have an extremely weakened immune system, like cancer and HIV patients, are at a higher risk of developing thrush. In fact, 1/3 of HIV patients report developing thrush at some point after being diagnosed. So, also if you smoke, if you are or have recently taken antibiotics, corticosteroids, or if you wear dentures, that also puts you at a higher risk of developing thrush. Generally, thrush is not considered a sexually transmitted infection. However, it can be passed from infants, who are also at a higher risk because their immune system is not fully developed. So if an infant has it, they can transmit it to the mother through contact with her nipple, and then she would have to get treated. How do you get treated for it? Well, there are antifungal medications that can be applied to the mouth and the tongue. That usually knocks it out. If that doesn't help it, or if you have esophageal candidiasis, then you would need to take a oral pill, most likely fluconazole. And you can get that with a prescription through your doctor. And let's keep it moving right along to vaginal candidiasis, more commonly referred to as vaginal yeast infections. In fact, it is the second most common vaginal infection, following right behind bacterial infections. And 75% of all women will develop at least one yeast infection in their lifetime. So it's very, very super common. Now, with yeast infection comes a lot of vaginal pain, burning, itching, painful sex, painful urination or discomfort with urination, and often involves an abnormal white, usually thick discharge, sometimes chunky, from the vagina with a yeasty smell. What causes it? Well, just like the oral candidiasis, there is a change in the vaginal environment that promotes an overgrowth of candida yeast. This usually happens because of a weakened immune system or when there is an increased amount of locked-in moisture down there. Pregnant women, women who take hormonal contraceptives like the birth control pill, women with heightened, weakened immune system like cancer patients, HIV patients, women who have diabetes, women who have recently taken antibiotics are all at a higher risk of developing a yeast infection. So let's say you have developed a yeast infection for whatever reason. How do you treat it? Well, antifungal medication can be inserted into the vagina via a tablet or a capsule where it dissolves and treats the yeast infection. Or you can go to your doctor and get prescribed fluconazole, which is a pill like we talked about earlier with the oral candidiasis. And there are a number of home remedies. Most popular would be yogurt without any sugar or added flavors or anything like that. To prevent this yeast infection from ever happening, it's important to wear cotton underwear, loose-fitting clothes, and to change out of any wet clothes. This includes swimsuits, sweaty workout clothes. It's just important to get out of those wet, tight-fitting clothes as soon as possible and to change clothes as often and as many times as you need to throughout the day. Generally, yeast infections are not contagious, just like the oral candidiasis, but there is a slight possibility that a man could get a yeast infection after having or because he had sex with an infected woman, especially if he is uncircumcised. Also, females can pass yeast infections to other females during sex. There's just not a lot of research put into this yet, but there is a slight possibility. Generally, it's not contagious. Now that we've talked about what candidiasis is, I want to show you what it looks like. This is oral candidiasis or thrush. Notice the white patches on the inner cheeks and tongue. And this is what vaginal candidiasis or a yeast infection can look like. Notice the white chunky discharge. And one last important point that I want to make about vaginal yeast infections is that if you have one, your chances of contracting an STD do go up. So it is important to stay educated, to stay happy and healthy and aware, and I hope you enjoyed watching and learning about this not so enjoyable infection. This has been a PSA by yours truly. You guys have a good day.